started. So welcome everyone to Mountain Talks. Before I say too much more, hopefully everyone can hear me. If you can't, let me know. There is a chat box. I'm going to type in it. I can hear myself, so hopefully you can hear me. All right, so again, welcome. My name is Lindsay Drake. I am a member of the Alumni Relations team here at Lehigh. And today we're going to be talking about health insurance markets with Chad Meyerhoefer, economics professor here at Lehigh in the College of Business and Economics. So thanks for joining us.
Sure, thanks for having me.
Yeah. All right, before we get into the talk, just a few housekeeping notes for everybody. If you've joined us before, you'll notice we're using a new technology. This is Zoom and not Adobe. We are testing Zoom out. We've used it a few times in the past. So let us know what you think about Zoom. I'll send a survey link out at the end of the talk. And how this works, I will stop talking in just a minute and let Professor Meyerhoefer talk about healthcare economics, specifically what he was speaking about in his blog that he wrote for the Lehigh Business blog. And then I'll ask him a few questions, and you as the audience will have the opportunity to type in your questions in the chat box. And I'm getting, audio has a very tiny sound in the chat box, so let me see what I can do. Oh, is this any better, perhaps? Let's see. Hopefully that's better. Okay, good, better. Excellent, thank you. So I was mentioning we're using Zoom. That's new for questions that you want to ask Professor Meyerhoefer that we'll get to in a few minutes. You'll be able to do that in the chat box. So just type your questions in the chat. What I will do is read them back to Professor Meyerhoefer, and he will answer them for us. Right. Again, I will send a survey out at the end of the talk. So we do value your feedback. We make changes based on what you say. So please let us know what you think. All right. So I will hand it over to Professor Meyerhoefer. And if you can explain to us why mandates are essential for health insurance markets, that's what we're here to talk about today.
Sure. So, mandates are something that we're very much used to in some types of insurance markets, like auto insurance or homeowners insurance, but they're a relatively new thing in health insurance markets. But irrespective of the type of insurance market, mandates are essential for that market to function properly. Now, so the ACA has a mandate, the Affordable Care Act has a mandate incorporated into it, whereby if an individual doesn't purchase health insurance or doesn't receive it for their employer and doesn't purchase it on the individual market, they would have to pay a penalty when they file their taxes. There's also an employer mandate to compel employers from dropping coverage and having the only option for their employees be insurance policies sold on the individual health insurance exchanges. So there's two different mandates. So the best way I think to explain, why mandates are important is to simplify things and think about the market just having two types of individuals who are healthy and individuals who are sick. Now, what an insurance company would want to do is they would want to be able to perfectly identify which individuals are healthy and which are sick, and they would underwrite different insurance policies for those two groups. They would underwrite a policy with the more limited coverage that's desired by healthier people, and they would charge a lower premium. And they would underwrite a policy that's more comprehensive, which would be desired by sicker individuals, and they would charge a higher premium to them. Now, if the insurance company can't identify who the sick and the healthy people are, then they have to charge everybody the same premium for one policy. And that premium would essentially be a weighted average of the premiums they would otherwise charge to the two groups, where the weights, that they apply to the prices would end up being the proportions of those groups in the population. What that means is that the price for insurance in that market would be too high for a healthy person. It would be higher than they would otherwise pay, and it would be too low for a sick person. Now, if there's no mandate that a person buys coverage, then what would happen is the person with the lowest expected costs, so you can think of that as being like the healthiest person in the market, they may decide not to buy insurance at all. Now, once they did that, that would actually change the amount that the insurance company would need to charge to everybody else, because now the proportion of healthy people is lower than it was when they first underwrote that policy and determined the premium. So the price would go up a little bit. After that price goes up, then probably the next healthiest person would then decide, okay, I don't want to buy insurance at all because this is a lot more expensive than I think I need. So they would drop out of the market. And then again, the insurance company would have to raise the price a little bit to reflect the fact that now there are fewer healthy people in the market. So this would continue, and to the point where the market fully unravels. And the only people left in the market would be sick people. So healthy people wouldn't have the opportunity to purchase insurance. And then, there could be further unraveling if we allow, the insurance company to write different policies potentially within the group of sick people. So that's the problem. Now, if you have a mandate, then people wouldn't drop out of the market, because if they did that, they would have to pay a penalty, and that penalty would probably be set so that the benefit they get from insurance, even though it's too high, it would still make sense for them to get the insurance, receive some benefit, and pay a little more rather than drop out, pay a penalty and get nothing for it. So if that were the case, then what would happen is we usually assume, and it's typically the case that when we're thinking about two groups of people, healthy and sick, there are more healthy people in the market than sick people. So if there was just one insurance company and one insurance policy in the market, then the healthy people would essentially determine the characteristics of that policy, because there are more of them. So it would end up being more limited coverage than a sick person might want, but the premium would be lower. Okay, so it would be affordable to sick people as well as healthy people, or affordable to people with lower incomes. So the one potential problem there is that with just one potential policy and a mandate, you could have less generous insurance for people who are sick and demand more insurance. However, if you allow that insurance company to offer a supplemental policy that provides them additional insurance, then the only people who would really want to buy that supplemental coverage would be the people with higher expected costs. So the insurance company would know that those people had those higher costs. It could identify them that way, and so that it could properly price that supplemental insurance policy. So as long as you have a mandate, you can have a situation where there are different insurance policies of differing generosities, where there's always a less expensive policy with more limited coverage, and there's other policies that are more comprehensive that can still be accurately priced. But without a mandate, that can't happen, because you have this unraveling of the market where all of the people who are have relatively lower costs would drop out of the market. So essentially, it's the mandate that keeps premiums affordable for everybody.
Okay. Yeah. So you mentioned in your blog that you generally agree that competitive markets deliver the best possible results for commodities, but that health insurance is an exception to that rule. Can you expand on that?
Yeah, so think of it this way. Let's say you're in the situation where you want to buy eggs at a grocery store, and so if the market is competitive, so there are multiple grocery stores where you live where you could buy those eggs, then what's going to happen is those eggs are going to be delivered to you at the lowest possible cost. And the reason why is that when you go to any of these stores, it's easy for you to figure out how much those eggs are worth, because they're already sorted in terms of size. And you could observe the quality of the egg because you can open up the carton and see whether any of the eggs are broken. Okay, so because of that, because you can easily observe the quality of the eggs, it would be impossible for one grocery store to charge more for those eggs than another grocery store, because everybody would just buy eggs from the cheaper store. And so what happens is that competition between those stores drives the price of eggs down to the point where the farmer isn't really making any excess profit on the eggs. They're basically covering their cost of production, but they're not getting anything more for it. So that's about the lowest price that they can deliver the product to you for. Now, one fundamental difference between something like eggs and medical care is that when you go to a physician to consume medical care, it's hard for you, or almost impossible for you, to observe the quality of that care. So, you don't necessarily know, like, for example, if, let's say, you have cartilage damage to your knee and you're contemplating having knee surgery. Well, you don't necessarily know how difficult it is to do knee surgery, how many resources are used to do the surgery. So there's no way for you to think about, well, what are the costs, and am I being charged a price that's higher than those costs? And you don't necessarily know how well your knee will function after the surgery. So there's a lot that you don't know about the quality of that care or what the outcome is going to be. And if you can't evaluate the product, the characteristics of the product like that, then you really can't figure out what it's worth. So it's very hard for people to know what the price is. Now, if you can't figure out what the price should be, then how could competition drive that price down? You might be worried that a physician who charges a lower price is only doing that because they're delivering to you a lower quality product, right? So those competitive forces are very limited in healthcare markets. Now, when we extrapolate this to insurance contracts are a little different in that you're really signing a contract to purchase the product at a lower price for the entire year, because most health insurance contracts are annual. So, it's really more like, an analogy in non-medical care markets would be something like you sign a contract with a landscaper to cut your lawn. Now, when you do that, the landscaper may charge you a certain price to come every week and cut the lawn. So think about what would happen if after you sign that contract, your lawn immediately starts to grow more quickly. That would impose a problem because the contractor, the landscaper, would have written that contract for a lawn that grows like a usual lawn does. But once you sign it, now the lawn's growing more quickly, which means they're not getting enough money to be able to cut your lawn. Well, health insurance is like that because once a person signs a health insurance contract, their behavior can change. So one general principle is if somebody's protected from risk, they could engage in more risky activities. So if I know I have health insurance, I may do things that expose me to injury that I wouldn't do otherwise. Like, let's say I ski, maybe I'm a risky skier, I'm not as careful about how I ski because I know if I get hurt, I'm not going to have to pay for, the medical care that's required. So that problem is called moral hazard, and that is another issue that we have in health insurance markets that we don't have in something like, the market for landscaping services.
So does the same hold true in terms of the fundamental difference that you're talking about in health insurance markets? Does the same hold true for other insurance markets, auto, homeowners?
Yes, it does. And so, for example, take auto insurance. If somebody is driving around without auto insurance, what it means is if they get into an accident, they're either expecting that they can pay the person whose car they've damaged, they can pay for that themselves, or that they won't be able to pay for it themselves and the other person just won't be compensated. So, it may be reasonable in some cases to think that a person could self-insure for auto insurance if they're only paying out claims to other people in the order of a few $1,000s. But if they run into somebody's house or if they, injure somebody in an accident, those costs could easily go in the hundreds of thousands of dollars, costs that are so high they couldn't reasonably pay them. So, an individual driving without auto insurance is essentially expecting those future costs to be borne by somebody else. Well, when you don't buy health insurance, it's the same thing. So no matter how healthy a person is at baseline, everybody has some exposure to risk. Everybody could be injured and could end up in the hospital. Now, the average hospital bill is over $15,000, around $15,000, and they can hospital bills can easily exceed $50,000, $100,000, $200,000 in some cases. Those are costs that most of us wouldn't be able to pay. So when you don't buy health insurance, you're expecting someone else to pay those costs. Mortgage insurance would be the same thing. So if you didn't buy homeowners insurance and you had a fire at your home, well, you could say, well, it's just you that loses the home, but in fact, you don't own the home. The bank owns the home. So actually the bank is going to end up paying, for the cost of that risk. So, that we have the same problem irrespective of the insurance market, and in the sense that if the individual isn't required to buy insurance, then they're just essentially imposing those costs on someone else, either another person, the government, or society at large.
All right, so we have a question from an audience member. Barry Weidman is asking something related to what we're discussing. He's asking, why have insurance markets worked well without a mandate before the Affordable Care Act?
So, it would depend on, whose perspective you're viewing that from. So from the standpoint of the employer-provided market, I wouldn't say they've worked well, but they've worked okay. And that's because an employer group could create its own sort of risk pool. So as long as individuals don't choose their job only because of the generosity of the health insurance benefits that are offered, an employer has sort of like a distribution of risk, within the company. And so there's healthy people and there's sick people. And because the employer usually pays for a large fraction of the health insurance costs, individuals almost always sign up for that insurance. So you don't have a mandate, but you have like voluntary enrollment that's almost 100%, and you have risk pooling. So, employer groups can sort of do that. Now, where things start to break down are when you have employers that don't offer insurance. And in that case, individuals in the past, their only option was to buy insurance in the individual market. Individual markets were highly dysfunctional because of the lack of mandate. So people who are seeking policies in the individual market, a lot of them were sicker than average, and that may be because their sickness limited their productivity and limited their ability to secure a job that offered health insurance, or it could be because they had a health shock, they got sick, they lost their job, and so they're unemployed because they are sick, and then they're seeking insurance in the individual market, which is their only option. Another factor to consider are overriding costs. So when you underwrite an insurance policy for a company, a large company, it's basically the same amount of effort to write that policy for 500 people as it is to write that policy for one person in the individual market, because it's individually rated versus group rated. So the overhead costs, the administrative costs can be 8 or 9 times higher to write a policy in the individual market, and that inflates the cost. So that, what that meant is that the combination of those two things essentially priced people out of the individual market. So a lot of people were uninsured. 20% of individuals at any given time were uninsured, and that, that's a reflection of the fact that those insurance markets weren't working well for everybody.
Okay. So we have a few more questions rolling in from the audience. The first is, I can't see your name, but while the term mandate is not normally used, aren't there effectively mandates in the auto and home insurance markets like we were talking about? before.
Yes, yes. So, there is actually a mandate. The mandate in auto insurance is a state law. So, in order to drive in that state, if you don't have insurance, you can be fined. I think in the mortgage market, it's not a legal mandate, but every lender imposes that requirement. So you cannot purchase, you cannot qualify for a mortgage if you don't have homeowners insurance. So those are essentially mandates.
Okay, and then the next question from William, he's saying that I guess then that you believe the current tax proposal being considered by the Senate that drops the penalty for not having insurance would essentially be dropping the individual mandate. So you're saying that will likely undermine the individual markets?
Yeah, so that would undermine the health insurance exchanges and all the individual markets that were set up by the ACA. And, the reason why is that you would have this unraveling of those markets where all the good risks would leave. And so that's why, like the CBO, which is a nonpartisan group, nonpartisan government agency, has estimated that if you drop the individual mandate, it's going to result in people being priced out of those markets. And so you'd have 13 million people additional uninsured, and you would have premium increases of about 10% per year over a 10-year period. And so that's what I mean about, the mandate is what keeps the premiums low. So once you get rid of the mandate, premiums are going to rise year after year as the market starts to unravel.
Let's see. So we talked just now about the tax proposal. Let's go back a little bit to the recently signed executive order that eliminates the cost-sharing subsidies for plans sold in health insurance marketplaces. What does that have any bearing on mandates? What bearing does that have potentially on the market?
Well, so that it's different from a mandate in the sense that the idea behind the ACA was that in order to make insurance affordable, this gap had to be closed for low-income working individuals. So, what we usually refer to as the working poor. And so what happened is the legislation compelled states to expand their Medicaid programs, and the Supreme Court subsequently ruled they didn't have to do that. So you have a little over half the states that expanded their Medicaid programs and another group that didn't. And then, so that's sort of raising generosity from lower income levels up. And then from the top down, there were these subsidies provided to insurance companies to allow them to offer insurance in the individual markets to individuals with low incomes at a lower cost. So essentially, if you take those subsidies away, then premiums will go up for those low income individuals. The far majority of whom are working, but they're in jobs that don't offer health insurance and wouldn't have previously before the ACA been able to afford health insurance in the individual markets due to the high underwriting costs and the adverse selection problems. So the result of that is premiums go up. Now, some insurance companies have already priced that into their premiums, and that's why this year we saw a jump in premiums in many market areas, and states allowing insurance companies to raise premiums because it was anticipated that those subsidies would go away. So in places where that's already incorporated into the price, nothing would really change. Nothing much should change. But not all insurance companies did raise their premiums in anticipation of that happening. So next year, they would do that, and premiums would continue to go up. And so I think what it would mean is that we'll have to see, because a lot of companies have said that as long as the mandate exists, they won't pull out of the market because there's still a potential for them to underwrite contracts in those markets with a mandate, but without the mandate that they potentially very likely would pull out. So it's possible that without those subsidies, eventually we'll have a situation where, and particularly in states that didn't expand their Medicaid programs, there will be a segment of people who are like, the working poor who are essentially priced out of the market. It really depends on how much of those costs are absorbed by insurance companies.
All right.
See, we've got one more question that came in from William again. Aren't a lot of the economics of the healthcare market driven to a very large degree by the distortive impact of employer-provided healthcare being considered tax-free fringe benefit? What would happen if employer-provided healthcare was taxed?
Yeah, so the way that health insurance is provided in the U.S. is sort of unusual. We're the only country, one of the few countries that provides insurance through employers like that. And just a small anecdote. So the reason for that is because during World War II, the government imposed wage controls to prevent wage inflation, but it didn't restrict benefit packages. So in order to compete for scarce workers, companies during the war started to offer health insurance, and then it sort of, persisted after the war. So yeah, right now that, the private health insurance is implicitly subsidized because it's tax-free. It comes out of pre-tax income, and individuals' premium contributions come out of pre-tax income. And then a company can write off the cost of providing that insurance from their corporate income tax. So if you change that, then that would raise the cost of insurance. So what would happen would be some of those costs would be passed through to employees in the form of lower wages or in the form of higher premiums. But it would essentially put like people who are entrepreneurs and don't have a company that they work for that can negotiate premiums for them on an even playing field. So, some of the older proposals, like by John McCain when he was a candidate for president, were to essentially change the tax treatment of insurance. Now, in some sense, like the way the ACA was set up was to not disturb employer-provided markets. Another way to go would have been to completely eliminate that market just by going to a single-payer system, so expanding the Medicare program to everybody in the U.S., and that would be similar to what's done in other countries. But there was, the problem, there's issues with that too, in that you're basically imposing one type of insurance on everybody. So it's not very popular in the U.S. to do that. If with the health insurance exchanges, changing, how employer-provided insurance is treated vis-a-vis the tax code is less important. And the reason why is that it's, I guess if you did take away those tax incentives, and more employers would decide it was worth it to just pay the penalty, the employer mandate penalty, and let their employees purchase insurance in the individual markets. And that would be probably not the worst thing in the world, because as long as those individual markets are well functioning, then there'd still be sufficient risk pooling with the individual mandate. So, it'd shift things around, but it wouldn't really fundamentally cause any large fundamental problems. I think that, it would be very disruptive, though, to the way insurance is provided now. So in my opinion, if you're going to do something like that, then you really should just consider a single payer system.
Okay. So it's almost 1 o'clock. We do have one more question that I'll pose to you, but if anybody needs to depart early, I am going to post the survey link up in the chat box now. So please go ahead and click on that before you leave. There it goes. So last question, and then we'll close from Barry. He says 80%. You may be
able to hear me better now. 80% of the people paying the penalty earn under 50K. How can the mandate be changed to keep it from being so regressive?
So I think that, so at some level of income, individuals are not subject to the mandate. So it doesn't go all the way down to zero in that sense. So my guess as to what's going on there is that a lot of those people are in states that didn't expand their Medicaid programs. Although I think people who would qualify for Medicaid in those states would be like up to 138% of the poverty line, would not be subject to the mandate. So it's probably more people who people who they don't qualify for Medicaid. They would potentially qualify for those health insurance subsidies, but because the premiums in the individual health insurance markets have gone up, they may feel that it's worth it to them to just pay the penalty as opposed to pay for the premium in the health insurance exchange. So to me, what would fix that? What would be any measures that you could take to shore up those individual markets in those exchanges, which actually ironically could be done by potentially raising the mandate for higher income individuals. It could also just be, there could be some tweaks that allow insurance companies to pool over larger market areas or sell insurance across state lines and things like that. So, obviously, like removing the subsidies to those markets would exacerbate that problem. Yeah.
All right. Well, we'll have to leave it at that. It's past 1 o'clock. We want to be respectful of everybody's time here, but thank you for joining us today. I think we had a great discussion. I'm sure if any of you still have questions, Professor Meyerhoefer would be happy to maybe answer them over email, or you can send them to me and we'll tackle them. But thank you all for joining us today online. Again, I've posted the survey link up on the chat box. I'll post it here again. We do value your feedback, so please let us know what you thought today. And thank you again for Professor Meyerhoefer for joining us.
Great. Thank you.
Bye, everybody.